So at this point, you're thinking about the investment in our medical exercise specialist or post-rehab conditioning specialist program. And you're looking at this kind of thinking return on investment. And of course, that now leads us to how much you can charge for medical exercise training services or sessions. Well, here's what we find. As a medical exercise specialist or post-rehab conditioning specialist, the education you're going to go through in our programs is pretty comprehensive, it's pretty detailed. It's going to push you, which means now you're going to become more of an expert, become more specialized in this area. As well as now you're going to manage your clients differently. You're managing them for particular functional outcomes. You're going to assess them now utilizing functional outcome measures. And many assessment procedures you may not be familiar with that are taught in both the MES and PRCS tracks. So now you're looking at becoming a specialist. And of course, you're going to charge a little bit more. So here's what our recommendations are. For the personal trainer or personal training assessment, whatever you would normally charge or is the going rate in your community, we're going to recommend you charge about 20% more for medical exercise training assessments. For the personal training sessions, we're going to recommend that you actually now charge about 20% more for medical exercise training sessions. And basically what we're saying here, folks, is across the board, we're going to recommend a 20 to 25% increase in your services because you've got to do the following. Now you've got to communicate with the doctor, therapist, or chiropractor in a written and also a verbal format. You also now have to document everything you're doing with your clients, and the training now becomes more specific for functional outcome measures, which means now a higher level of professionalism. So your return on investment, actually you're going to get your money back with our MES or PRCS programs because we're going to recommend, because of your higher level of professionalism, now you're going to charge about 20 to 25% more. So here's what I'd like for you to do. Go out in your community, look around in your community and get an idea of the average price for a personal training assessment as well as a personal training session. And what you're going to do for your clients that have medical conditions and are seeking you out for medical exercise training, you're now going to charge your services at 20 to 25% above the going rate in your community for personal training assessments as well as personal training sessions. But folks, remember, it's not just because you have the certification that now allows you to charge more. It's the level of professionalism that you're now offering to your client, the higher level, which means documentation, communication with doctors, therapists, and chiropractors, and now we're actually managing our clients toward functional outcome measures that are positive.